when I do talks to nurses, nurses will say, well, there's nothing really we can do. You know, we don't have institutional support, we don't have this, we don't have that, the doctors won't like it, et cetera, et cetera. If you do just one thing that's different tomorrow, one person's actions or words can change the dynamic of an entire group. Not always, but sometimes. You'd be surprised. You'd be surprised. And a lot of times nurses will say, well, I don't have the power, you know, I'm just a nurse. And I've heard that, just a nurse, so many times. I've heard people say that so many times that I wrote a, I don't know, what some people think of as a poem, I don't know what really it is, but, and I would like to conclude with reading that. It's actually, I made it into a poster and a bookmark because I hope people will remember it. So, I'm just a nurse. I just make the difference between life and death. I'm just a nurse. I just have the educated eyes that prevent errors, injuries, and other catastrophes. I'm just a nurse. I'm just a nurse researcher. I just help doctors and nurses give better, safer, and more effective care. I'm just a nurse. I just work in a major teaching hospital, managing and monitoring patients on toxic experimental treatments. I'm just a nurse. I'm just a geriatric nurse practitioner. I just make the difference between patients staying in their own homes or going to a nursing home. I'm just a nurse. I'm just a school nurse. I just make the difference between kids staying healthy so that they can learn in school. I'm just a nurse. I'm just a palliative care nurse. I just make the difference between patients dying in agony and dying in comfort and with dignity. I'm just a nurse. I'm just central to the real bottom line in healthcare. Won't you join us and be just a nurse too? Thank you.